Hi, everyone. Welcome. My name is Stephanie Haynes. I am the Director of Philadelphia Family Pride. We have with us today Gabby Hochfeld from the Bradbury-Sullivan Center in Allentown. That's the LGBT center there. And she is the health outreach coordinator and is going to share with us some interesting information about tobacco and talking about tobacco with our families and youth, etc. So I'm going to turn off my video and audio, turn it over to Gabby, and feel free to drop questions in the chat as we go. Great. Take it away.
Awesome. Okay, let me share my screen. Okay, so title, LGBT tobacco use and COVID-19. And we're also gonna take a focus on how families and parents can make sure that the community is supported as well. Just a bit of information about the Bradbury-Sullivan Center. It's a nonprofit LGBT community center, which has a bunch of arts programming, health, public health efforts. We have a youth program and pride programs. Like we also, we are the main organization that deals with Lehigh Valley's Pride Festival, which was virtual this year. And we also have a bunch of other resources on the website, so be sure to look out for that. And if you have any questions, feel free to email me. I'll have that at the end. So today, this is basically the theory here. Tobacco use rates are higher among all LGBT community demographics. And the youth currently use electronic vapor products more often than their heterosexual counterparts. This statistic is around 50% higher for the LGBT community, and depending on what sect of the LGBT community, it'll be higher. Thankfully, LGBT-led families and parents can play a major role in ending this disparity by engaging in family discussions, providing friendly and competent resources, modeling tobacco-free behavior, like making sure that they use positive coping mechanisms, and take advantage of the LGBT affirming tobacco cessation resources. So this is just gonna focus on individual changes that families and parents can make to enact, leading to change, sorry, my little bubbles blocking it, within the greater LGBT community. Let me pull up my notes. This is all kind of a little new to me. Okay. Oh. I'm sorry, I had to pause. I'm having an issue with finding the speaker notes on Zoom, but I think I can find it. Anyway, I'll just go off the cuff. So according to our most recent health needs assessment that we just did this year, it ended, it started end of last year. Our results of it showed a lot of interesting things because we've been doing this for about 5 years, and we have 2.5-ish other of these health needs assessments to compare it to. So it was interesting to see how COVID-19 changed the results and how it might have affected it, which is, I was very curious about, because I was wondering if maybe some people would take up smoking again or whatnot. But what the results said is pretty interesting. Cigarette use looks like way higher. That might have been because of the way that the question was framed, because we use the CDC's term ever smoker, which means have you ever smoked a cigarette versus are you a regular smoker? And that distinction actually raised it. We decided we didn't like the term ever smoker. So we used if you consider yourself to be a smoker and if you've ever used products all in one. So 50.8% of the LGBT community respondents answered yes, which is concerning because that number is way lower for the general population. So there's associated stigmas and probably not probably, definitely some influence coming from tobacco companies with their advertising towards these communities. E-cigarettes are also heightened since the years before, at 1 in 4 about use e-cigarettes, and that isn't including puff bars, which is a new product that gets around some flavor bans. So again, like we keep having to play catch up with the tobacco companies, because every single time we think we're getting the most updated information, there's something else that comes out while we're looking at the data that makes it harder to gauge what's going on. Hookah and cigarettes, or cigars and cigarillos and chew and stuff, that's not really, I mean, those are higher than the general community, minus the chew part, because it's not really something that's in the culture. But it's still an issue. But the main issues are with cigarettes and e-cigarettes and kind of hookah and the other stuff. We also...
Can I just interrupt you for a second?
Sure.
And people could have answered that they use more than one of these, right? So somebody could say, yes, I use cigarettes and cigars. And so they would both show, you know, that's why this adds up to more than
absolutely
100%. Okay, just checking. Cool.
Yeah, I think that was also kind of a difference in the asking of the questions from the last time too. We also pulled data from we wanted to show what all the respondents looked like versus age, people of color, looking at our more vulnerable parts of the community, like transgender, non-binary, and genderqueer, and also our bi-pan. And surprisingly, it's actually about the same for the trans, non-binary, and genderqueer community. I think that has to do with outreach efforts in those areas, because usually those communities have these disparities at higher rates. So hopefully it was because of the outreach towards those communities. I'm not entirely sure why it's slightly lower. For ages 24 and under, for tobacco use, it is lessened. And I'm wondering about, I think that has to do with also that in general, youth are starting to realize that e-cigarettes are not super great for you, as well as Tobacco 21 was just passed last year, and that might have had a huge effect on just ability to get the products, because what that law or policy now does is raise the legal purchase age of tobacco products from 18 to 21. So that could have decreased it. I'm hoping it did, and I think it did too. It's raised, unfortunately, for people of color and for the bi-pan community. So I guess that's something that we're going to have to focus on more with our outreach, for sure. But all of this data together continues to show that tobacco-related illnesses are the #1 cause of death in the LGBT community. And that's a pretty wild statement to make when perceived issues within the community are mental health and violence towards the community. So we although those are all contributing factors to why someone might start smoking, because a lot of these reasons are just from negative coping mechanisms because of minority stress. So it's all related, but when you think about what's actually causing death, it's from all these tobacco-related illnesses. So it's really important to do this work and to make sure that we're taking pride in our health, because it's really affecting us. Tobacco use, as we hopefully know, it decreases your immune health. It leads to lung cancer, COPD. It's not good for you, and definitely not in a pandemic, but we're going to talk about that later. Let me get to the next slide. So one of these things something I want to talk about specifically is perceived provider competency. This is a huge issue, because when you know that the community has all these disparities, it's really important to make sure that there's help with this, which means going to a healthcare provider and getting that information about what's wrong with you and how to correct it and how to lead a healthier lifestyle. But there's a lot of barriers with the community, and if they can't get to the place because they were thrown out of their home because they were not accepted, which is something that can be easily prevented by families and parents, which is to just accept your child and provide a home for them. But these minority stressors also come from the way they're treated in the healthcare facility. The LGBT community is a marginalized group. Creating a welcoming environment is essential to the experience of any patient. A pride flag goes a long way. It's not going to solve everything, but it shows that at least the people in that building are going to help you and accept you at the very least, hopefully. 23.4% experience a negative reaction from a healthcare provider. That is almost 1 in 4. That is wild. We need to stop this. If you are going into healthcare, you take an oath that you need to, make sure that you're caring for all people. And the LGBT people are people. So we need to really make sure that our healthcare workers are competent and accepting of the community. But friendly isn't just enough anymore. Knowing the specific needs of the LGBT community is crucial. And we evolve every day. There's more and more different types of the LGBT community going on, and the needs grow and change. I was in a conference for, it was a cultural competency training for healthcare providers, and I sat in on it. And there was a really wonderful video that was shown about how easily you can trigger somebody that is trans or non-binary or just not on the spectrum of not on the binary of gender. And it's so important to make sure that we use terms that are going to be helpful to not making someone's experience miserable. The first thing that you want to make sure when you're walking into a doctor's office is that you feel safe. So this is really important. 1 in 5 almost do not believe most of their healthcare providers are culturally competent with respect to the LGBT community. Again, we need to make sure that, how can we feel safe and secure and that someone understands our needs, but they're being called a professional. And it's very difficult to feel like you're getting the care you need, and you're less likely to want to go back to a doctor and get the things that you need to take care of yourself. So the goal is to inform and educate healthcare workers. Educating healthcare providers on LGBT specific issues is key, and 35.4% do not believe healthcare providers have the medical expertise for LGBT health needs. I am really, really hopeful for this though, because I have family who are becoming nurses or are already nurses, and I have friends too, and we also have a resource at the center where for nurses to be culturally competency trained. And it seems like a lot of people really want to learn and make sure that they're providing the best care to their patients. So I think that this is something that will be changed within the decade and not be as much of an issue, hopefully. But it is really important to prioritize now, and hopefully this information can be spread so that we make sure that it is prioritized. And it's really important for parents and families to prioritize this for their children and for their loved ones in general, because if you're taking your child to the doctor and the doctor says something that is completely homophobic and you just stand there watching and not saying anything, your child's not going to feel supported from you. So it's really, really important to advocate for your child in these situations.
I'll just jump in too to say that the group Family Equality has some really good training modules for professionals around LGBTQ cultural competency, as well as specific ones for people who work in family building, so that LGBTQ folks who are looking to expand their family or start their families, should have the same expectation. And there are resources out there.
Yeah, absolutely. So another thing that I think is important to know is that this is completely unequivocally intentional. The tobacco industry knows what they're doing when they're this is not just LGBT people deciding to negatively cope. This is absolutely intentional from big tobacco companies. And the way that they do this is by taking advantage of these minority stressors, like I said before. Knowing, and this is not only specific to the LGBT community, this is also specific to the Latinx community, the Native community, and the Black and Brown community as well. Any sort of minority group has heightened tobacco disparities because of this. And it's by them invading queer spaces and other spaces for other communities, but specifically right now we're talking about the LGBT community. And some ways that they do this is by invading gay press publications, by taking out ads, bars. For the longest time, the only spaces that were friendly for LGBT people to go to were bars. That was a huge part of the culture. And when the only spaces that you're welcome in, sometimes substance abuse, it becomes part of that culture. And it's really hard to break free from. But thankfully, we caught this because they also sponsored Pride festivals. And now in Pennsylvania, all but Philly and Pittsburgh Pride are smoke-free and tobacco-free too. So it's really important to make sure that we say loudly and clearly that we do prioritize our health, and this is what people want. Another thing that I want to mention is Project Scum. This was a marketing campaign towards homeless men and gay men in California in 1995. These are searchable. This is one of many advertising and marketing campaigns that have happened that are just obviously homophobic. And it's really, really, I think the next slide, I have a short video that goes into some of the actual ads that have been shown that make it sound like tobacco companies get the LGBT community. It's really backwards and messed up. Then last thing is targeting our youth. The earlier you can get someone hooked on tobacco, the better. And 9 out of 10 adult smokers had their first cigarette before the age of 18. And I think there's another statistic. I have it in my notes, but I am unable to find it in an eloquent way. But I think it's 95% of adult smokers over the age of 25 had their first cigarette before the age of 15. It's really young. And a lot of people that I personally know that have like their first cigarette when they were like children. And I have never smoked a cigarette, but thankfully, but just knowing how much nicotine are in these products, especially now with e-cigarettes, which have a cartridge is equal to the amount of 1 pack of cigarettes worth of nicotine in it. They are highly addictive. So when you have younger people with developing brains, it's much easier to get them hooked on this. So they're gonna definitely advertise more towards youth and make sure that they can prevent any sort of policy changes from happening. So that's really good that we got Tobacco 21 to pass. So here's a short video. It's like 2 minutes long of Dr. Scout from the Network for LGBT Health Equity at Centerlink. And he's just gonna talk about some of the examples of big tobacco companies infiltrating the gay community. So let me just start that up.
Smoking is the largest preventable cause of disease and death in the United States. Lesbian, gay, bisexual, and transgender Americans smoke at much higher rates than average, so they suffer more smoking-related death and illness. Dr. Scout directs the Network for LGBT Health Equity at Centerlink. Here, he talks about what smoking does to LGBT communities.
Unfortunately, lesbians, gays, bisexual, and transgender people don't even realize that we smoke more than other populations. And at the same time, the tobacco control movement often doesn't realize we do too. As the next generation comes out and tries to find their leaders, they see people who are smoking, and it keeps, it's really like a socially transmitted disease. While many of us are really outraged, a lot of us do not understand that we even have a disparity.
The tobacco industry has a long history of marketing to the LGBT community.
there's a lot of community gratitude for the tobacco industry, which has moved in early and swiftly to be LGBT community supporters. We also saw the tobacco industry spending more money on telling us how great they were with our rights and issues than they were even spending on supporting us. We've seen the industry twist our civil rights issues to look like that freedom to smoke is like civil rights for LGBT people. We also really need the regular tobacco control programs to routinely include LGBT-tailored work. I mean, we have a huge history of discrimination against us in the healthcare arena, which means that we're not going to trust you unless you prove that you're different than the history. So if we see the policymakers prioritize LGBT tobacco stuff, that will be one of the best ways to help the community realize it, get educated, respond, and build the infrastructure as well.
This video is a production of the Office of the Surgeon General and CDC's Office on Smoking and Health.
Yeah, so really the last ad gets me so heated because of how completely, that is queerbaiting. That is absolutely queerbaiting. I have been accused of queerbaiting for this. I'm like, nope, it's coming from the tobacco industries. We're trying to unqueerbait this stuff. So it's really important that families, parents, teachers, everyone in the community needs to advocate for these policies, because it is very hard to combat huge corporations that are putting out this information, because obviously now we see that that is just completely wrong, but who knows what the next completely wrong thing is when you're in the moment. So it's really important to look at this with a keen eye and make sure to call it out when you see it, and fight for these legislative efforts. No, there we go. So thankfully, this needs assessment continued to prove that the community does not want tobacco to be a part of their culture, and that the LGBT people do care about their health. Over half agreed Pride festivals should be smoke-free events. That's higher than the last time. We're on a roll. Almost 70% agree that bars should be smoke-free. That's really, really big, because it took a lot to get Stonewall and Allentown to go smoke-free and tobacco-free. So it's really important to know that the community wants this too, so that these bars can still thrive. Around 40% are interested in quitting smoking in the next 6 months. That is really amazing, because that means that even in a stressful pandemic, we're actually really, really focused on our health still. So I'm really, really happy to see that having grown. 44.2% feel most comfortable receiving cessation care from a doctor. This is important to know, because we need to make sure that our doctors, like many LGBT people in this survey, show that they don't have a regular primary doctor. So having somebody that can see them change and grow over time and in their health is really, really important. Having a different doctor every single time is a bit difficult. So, and this also shows that the quit line might not be the most ideal way to get cessation materials from for people. So we need to maybe re-strategize and make sure that when doctors are dealing with LGBT patients, that they are also asking these questions, like, when you smoke, do you want NRT, which is nicotine replacement therapy? Do you want cessation counseling? Like, what do you need that's going to help you? And then 65% agree that vaping, juuling, and e-cigarettes are a threat to the LGBT community. So we're on a roll with this. It shows that this information is getting out there, and we need to make sure that these stigmas are not happening anymore. LGBT people are not a targeted audience that really wants any of this. So back off, tobacco companies. So with COVID, really, really interesting information coming out about this. So because it attacks the lungs, the coronavirus that causes COVID-19 could be an especially serious threat to those who smoke tobacco or marijuana or who vape. Studies show it is a crisis within a crisis. Overall, the concerns include that COVID may increase tobacco consumption and decrease access to healthcare. This makes sense. It's harder to, a lot of people have lost their jobs. A lot of people have already had issues of transportation, and it might not be safe to get an Uber or take the bus anymore. So it's really, really difficult. All those accesses to care and barriers to care have increased and decreased, or decreased and increased. Smoking-related morbidity and mortality could increase in the coming years. Smoking and tobacco-related diseases are prognostic factors for severe COVID-19, and tobacco control is a greater challenge than ever. And that's very true, because it's very hard to do outreach when you can't travel and you can't be in person with people. So I have to do a lot of my work virtually, and especially with youth, it's really hard for them to get online anymore because they spend their day on the computer all day, and then they want to. It's difficult to encourage them that this is important enough for them to do, because it's just another task, and it's really difficult to be a young person right now because you can't go and socialize like you normally would be able to. So what this means for the community is that all the things get worse, unfortunately. This is a respiratory pandemic, and LGBT people use tobacco at twice the rate as the general population. So this is not really looking good, but thankfully more people want to quit. So there is like hope. It's important to note that the pandemic really does hurt for those who were already hurting. Coronavirus, I already said that one. Higher rates of HIV and cancer among LGBTQ plus individuals mean that the greater number of us may have compromised immunity. This is one of the main reasons we had to close the center down, because a lot of our population is very vulnerable. Obviously, we closed it down in person because of those are the guidelines that are required, but especially for our community, we really want to make sure everybody's okay. And LGBT people experience health disparities and many barriers to care. Like I said, all of this gets worse when the world is on fire a bit. So how can you help as a family? Support at home. 1 out of 10 LGBT people reported that they don't feel like they get the support that they need in general, and they don't feel respected in their communities or outside of their communities. So just making sure that you're doing your part in this pandemic to keep your loved ones safe, especially LGBT loved ones safe, and make sure to let them know that you care and that you support them. That can go such a long way. Educate yourself. If you don't know what's going on, you can always ask questions, but it's good to just, use your search engine that you like the most. Bing, Google, I don't care. Look it up or for yourself, but sometimes questions can be more difficult, and that's why you need to use resources like Philadelphia Family Pride, Bradbury-Sullivan LGBT Community Center, just all those organizations that keep being thrown your way. Use them. Call them, ask them what's available to you for you to help. I know at the center we have Parents of Trans Kids, which is a community group that happens where parents of trans kids literally meet up and talk about their experience together. And that's a really great way to learn about things from each other. Some parents are better at it than others. Learn from them. Destigmatize. If you see something, call it out. If somebody's being a bad person to somebody who's queer, if they're being homophobic, if you see businesses doing the wrong thing, call it out. You need to write to them. You need to write them a nasty letter. You need to do something about it. Show the LGBT community that you care. Don't just idly watch by, because it's really hard to speak up when you're the one that's being attacked. If you somebody else who has more, this is making space for other people. So just if you can say something about it, then do so. And then advocate for competency. Make sure that when you see those things, tell them to go get culturally competency trained. Make sure that the teachers in your schools are being trained. Make sure that the doctors are being trained. Just advocate for people to do better and know more. So just a resource for parents who might want to have their kid get involved with something really cool. The Tobacco Resistance Unit is a youth-led advocacy movement ages 12 to 18 are welcome to join. It's not just for LGBT people. And it has a goal of educating young Pennsylvanians about the dangers of tobacco and nicotine addiction and expose big tobacco's marketing lies. And events with them that we've done, I am what would be the person to sign people up, is writing letters to representatives. We have letter writing parties, which are really fun, and it gets people really excited about doing something in the community. Day at the Capitol. This is virtual now, but we used to go in person to Harrisburg and make sure that our legislators know from our youth specifically that they don't want tobacco companies to be infiltrating their lives. Community outreach. We would also make signs and do fun events for tobacco-free holidays, and sharing cessation resources, just making sure that people know about the quit line and the places that offer tobacco resources to help you quit is really important. And also, there's scholarship opportunities. So parents, if you want to help your kid get a scholarship, this is a really great way to help them with that. So if you want to email me about more information for this, that would be really cool. We also have another really cool thing. If you are smoking and wanting to quit, you could be part of a research study from UPenn called RISE, which is Research in Smoking Elimination. It's a great way for us to collect information that will help our LGBT public health efforts. And it pretty much is just looking at the relationship between tobacco cessation and HIV positive folks. And we're just looking for current smokers who are trying to quit. Email me if you want to get involved with that. It's really a really great opportunity. And you're compensated for your time and travel if there's any. Here's some sources. All of that is available to you. I pretty much mentioned most of it. And then those are some of the studies that we referenced. And here's some PA cessation and LGBT-friendly resources. I put the quit line information. Philadelphia Family Pride is a great resource. If you don't already know about it, you probably do since you're watching this. And Southeastern Pennsylvania Tobacco Cessation and Nicotine Replacement Treatment Programs. If it's by county, and if you're outside of Philly watching this, feel free to look at that too. And thank you so much. There's my email. If you have any questions, let me know. And make sure to follow us on all the social medias. That went a little longer than I thought.
That's okay, great. Thank you so much, Gabby. Really interesting stuff. I think I asked the questions that came up as they went along and don't see any other ones right now, but I did want to just plug that the Philadelphia Office of LGBT Affairs, the Mayor's Office for LGBT Affairs, recently did like a really deep dive into the history of tobacco company marketing to the LGBT community. And it was, I mean, you touched on it, and it's any amount that you see is horrifying, but for people who are really interested in that, they should look at the Philly Mayor's Office for LGBT Affairs Facebook page. And there's a really interesting, I think they've posted it on there. Anyway, I attended the Zoom thing. So thanks for the Philly PFP shout outs. Thanks for all the work that you do. And if folks want to get in touch with us, it's philadelphiafamilypride.org or Stephanie at Philly Family Pride.
Yeah, great. Thank you so much for having me. It was a pleasure.
Great. Thank you.